You went to the dentist expecting a standard, 30-minute cleaning covered by your insurance, but instead, the dentist looked at your x-rays and told you that you need a deep cleaning that's going to cost you hundreds, maybe even thousands of dollars out of pocket. It feels like a total dental scam, right? And your first instinct is probably to just refuse it, walk out, and go home. But what actually happens to your mouth if you just say no? In this video, we are going to look at the exact disgusting thing that happens under your gums if you refuse a deep cleaning, how the step-by-step procedure actually works, the real cost breakdown, and how to know if your dentist is being honest or just trying to upgrade your bill. If you're new to the channel, my mission here at Fix Your Smile is to help you understand your oral health so you can protect your teeth and save thousands of dollars in unnecessary dental bills. Hit that subscribe button right now so you don't miss our weekly dental breakdowns. To understand why refusing a deep cleaning is a massive risk, you need to know the difference between a regular cleaning and a deep cleaning. A regular cleaning is called a prophylaxis. It only cleans the part of the tooth you can actually see above your gum line. It's purely preventative. But if you have gum disease, also known as periodontitis, bacteria has already broken past your gum line and trapped itself deep inside pockets around the roots of your teeth. Over time, that bacteria hardens into a substance called calculus, or tartar. Think of calculus like biological cement. It is physically impossible for you to brush it off, floss it out, or rinse it away at home. No matter how expensive your electric toothbrush is, it cannot reach this. So, what happens if you refuse the deep cleaning and just leave that calculus sitting on the roots of your teeth? It's not a single dramatic event, but a slow, destructive process. Let's walk through the timeline of what you can expect as your body tries to fight a battle it can't win on its own. In the first 1 to 3 months, your immune system views that hardened bacteria as a constant infection. It sends blood to the area to fight it, which is why your gums become red, swollen, and bleed every time you brush. This is chronic inflammation. You'll also likely notice persistent bad breath, or halitosis, caused by the bacterial waste products, and increasing tooth sensitivity as your gums begin to recede. Next, the bacteria begins to multiply downward, shielded from your toothbrush and floss. Because it's trapped, it literally starts eating away at the periodontal ligaments and the jawbone that holds your teeth in place. This process is silent and often painless in the early stages. By the 6-month to 1-year mark, those microscopic pockets under your gums get significantly deeper, trapping even more food and bacteria. Once the bone structure drops past a critical point, your teeth will begin to shift and feel loose. And eventually, a perfectly straight, cavity-free tooth will literally fall out of your mouth because there is no bone left to hold it. This isn't a scare tactic. It's the predictable biological endpoint of untreated periodontal disease. So, you've decided to move forward with a deep cleaning. That's a fantastic decision for your long-term oral health. To ease any anxiety you might have, let's walk through exactly what the procedure, technically called scaling and root planing, looks like step by step. Knowing what to expect is the first step to feeling comfortable and in control. Step 1 is numbing. Because the hygienist needs to clean deep below the gum line where the tissue is sensitive, they will first numb the area. This usually starts with a topical gel, followed by a local anesthetic injection. The goal is your complete comfort. You might feel some pressure during the treatment, but you shouldn't feel any sharp pain. Step 2 is scaling. Now the main event begins. Your hygienist will use special hand tools and an ultrasonic scaler. This advanced device vibrates at a high frequency and shoots a cooling stream of water to literally blast and wash away the hardened, concrete-like tartar from the roots of your teeth. Step 3 is root planing. Think of this like sanding down a rough piece of wood. After the large tartar deposits are gone, the hygienist meticulously smooths out the surfaces of your tooth roots. Why is this so critical? Because a perfectly smooth root makes it incredibly difficult for new bacteria to stick, creating a clean slate for your gums to heal and tightly reattach to your teeth. Step 4 is irrigation. After all that cleaning, your hygienist may perform a final flush. They'll use an antimicrobial rinse to irrigate below the gum line, washing away any lingering debris and killing off remaining bacteria. This helps kickstart the healing process and reduce the risk of infection. Step 5 is post-op care. You're all done. Your hygienist will give you instructions for the next few days. Expect some mild soreness and sensitivity, which is totally normal. They'll likely recommend sticking to soft foods for a day or two and may suggest a special mouth rinse to aid healing. Following these steps is key to a fast and comfortable recovery. Now, let's talk about the money. Why does it cost so much more than a regular cleaning? A standard cleaning might cost you $75 to $200, but a deep cleaning is much more intensive and is charged per quadrant. Your mouth is split into 4 quarters. On average, a deep cleaning costs anywhere from $150 to $350 per quadrant. If you need your entire mouth done, you are looking at a total bill of $600 to $1,400. Furthermore, standard insurance plans usually cover 100% of regular cleanings, but because a deep cleaning is considered a treatment for a disease, insurance often only covers 50% to 80% of it, leaving you to pay the rest. So, how do you know if your dentist is telling the truth or just trying to make an extra buck? It can feel overwhelming, but the power is in your hands. The key is to ask for the 4, 5, 6 or higher. That's a red flag for active bone loss. Next, ask to see your x-rays. They can visually confirm bone loss around your teeth. Also, ask about your bleeding index and if they have photographic evidence from an intraoral camera. Healthy gums don't bleed during probing. If there's significant bleeding and visible inflammation in the photos, it supports the need for treatment. If the evidence doesn't add up, or you still feel unsure, always get a second opinion. It's your health and your money. You absolutely need that deep cleaning to save your smile. Have you ever been told you need a deep cleaning? What did your dentist try to charge you? Let me know in the comments below. Drop a like if this video saved you some anxiety, and I'll see you in the next video. Thank you, Micah and Olivia.